Hello everyone, I'm Eszter Vajda and welcome to Hometown Talents and Treasures. Our guest is Shelly Manougian. Shelly has a store in New Hampshire called Bella Intimates, but while yes, there are plenty of lingerie and nice things in the store for sale, it also serves as a place where breast cancer survivors can start feeling whole again with specialty fitted bras. Shelly is a board certified mastectomy fitter. Shelly was recently featured in Fearless Women, Visions of a New World. Fearless Women, Visions of a New World celebrates strong women with a mission to create a new and better world. In 2011, Shelly was awarded an International Women's Day Outstanding Service Award. These awards are presented worldwide to honor the women for their extraordinary efforts to make a difference in the world. We caught up with Shelly in her store in Rye, New Hampshire. Shelly, thanks for having us here in your store and welcome to Hometown Talents and Treasures. You've been working with women with breast cancer for many years now, fitting them with bras. How did you get involved in this?
Well, I've been a bra fitter for the last 20 years, and I decided back in '99, I had this epiphany that if I could help women, average women, feel whole, well not whole, but feel good about themselves just with a proper fitting bra, I thought it would be something I wanted to offer women who had been through breast cancer. I think that's a really big part of the healing process for a woman after they lose their breast, to kind of feel whole again and like themselves. And I think when you feel more comfortable in your body and you feel it within, it's going to help you with the healing.
And you know, breasts for a woman, it's a really important, intimate part. What kind of stories did you hear from women coming in here losing a big part of themselves?
Well, a lot of women handle it differently, but the majority feel like a piece of them has been taken away. They may not have been the type of women that were real sexy and wore their breasts first or anything, but it's still a piece of their body and their anatomy, and they just didn't feel whole like a woman. So a big part for them to come in, and again to get back to the healing process, was to be able to be fitted to a prosthetic that gave symmetry and looked like their natural breasts as far as in their clothes and everything. So, and a lot of women who come in, they're a little nervous. They don't know what to expect. They don't know. There's just so much going on, after treatment and everything. And they're so used to that sterile environment from doctor's offices, and hospitals, that they just don't know what they're gonna walk into. So.
And after you fitted them and you gave them their bra, what kind of change did you see in them, not only physically but emotionally?
Well, instantly their body language becomes very different. They become more comfortable and confident within themselves. And a lot of times they're in tears. They're so overwhelmed just because they're on the process of healing and on the process of feeling like themselves again. So it can be very emotional for a lot of the ladies. Sometimes the ladies are very frustrated because they've been through so much, and it's just another invasion of just, it's just a reminder. So once they can get to the point where they're healed and they can be fitted to a prosthetic and a proper fitting bra, which is a really big part of the puzzle, or the big part of them healing, it just helps them on their journey of getting back to their old selves again.
And a few years after you had this epiphany that this is what you wanted to do, you yourself got colon cancer.
I did, and it's an ironic story. I had just expanded my business, and I had a lot of personnel from the different local hospitals here. And I was actually standing in this room at the end of the event, and I was just talking to a woman who happened to be the director of oncology for Portsmouth Regional, and I just out of the blue had a sharp pain. And I just kind of stepped back, and she just said, what was that? And I said, oh, it was just a sharp pain. I get it once or twice a year, and I forget about it. I'm busy. I'm a new business owner. My shop was with my baby. It was only 1.5 years old. I never felt sick. And so this woman made me an appointment to have a colonoscopy. And I kept the appointment because I thought it was a new business acquaintance. I had health insurance. What was the big deal? Other than the prep for the test, I thought, I can do this. So I did it, and the test results came back that I had third stage colorectal cancer. And so she basically saved my life. If it wasn't for her being at this place at this time, I wouldn't be here right now. So I feel very blessed.
You had a 20% chance of survival, and you've been working with women with breast cancer, and you get this news. What was your reaction?
I don't know. I was kind of numb to it, maybe a little naive, even though I work with a lot of women with breast cancer. I had just previously lost my parents too, like a year and a half prior to that. So I kind of went like on autopilot. I really didn't think about it. I kind of had done what I was told. And a big part of the story is my boyfriend had suggested that we go to Boston. You know, the gentleman, the surgeon, was very nice and everything, but he was 32 and had only done 6 surgeries. So I don't know if I would have thought to go to Boston. Sometimes you kind of get like on autopilot, and you really need an advocate for yourself. So I think another reason I'm here is my brilliant surgeon, who I adore to this day. And I think, you know, he was a big piece of the puzzle also. I had good people in my life that helped me through this journey. I went to Leahy Clinic, Dr. Schetz, and he's amazing. So I have had several people, which is ironic, with colon cancer since my diagnosis, who didn't make it, and they weren't as far advanced as I was. They were first and second stage. One was a cousin who was 44, so you know he was 6 years my junior, and they didn't make it. So I feel I'm here for a mission, and I need to continue my journey of getting my business to that next step and get the accreditation so I can do medical billing for women. Because I love what I do. And I really feel it's a big part of the healing for these ladies, and I feel like that's why I'm here. You know, why me and not them? These other people, like I said, they were healthy, they had families, and you know, I made it and they didn't. So I kind of feel I'm here for a purpose.
So, you know, you talk about colon cancer, and probably breast cancer is the most known.
Correct.
What kind of education needs to be out there about colon cancer?
Well, I just think you need to listen to your own body. I was very busy. I didn't notice a lot of signs, and if it wasn't by this woman happened to be here and make me the appointment, I probably wouldn't be here today to talk about it. But I really feel you have to listen to your bodies, and I think if, you know, if you're not feeling the same, if you're tired, if you're getting bloat, you know, all these little things, everyone probably gets different symptoms. If you go and you look it up online, there's a list of symptoms that you should look for and be aware of, which I won't get into here because it can be a little graphic. But I just really think the key part is listening to your body or having someone to talk to if you're not feeling 100%. I think women, we're so busy doing things for other people, and we're busy with our careers and what it is. Sometimes, you know, things go on the back shelf. Yeah. Or you just think not me. Like I never felt sick. I was tired, but I was working 60 hours a week. So I just never thought I was sick. So.
And so you still have to go and get checked
yes.
every year.
Yeah, every 3 years now for a colonoscopy, and every year, twice a year for blood. And I'm 8 years out. So you know, sometimes I think it's, you know, a little much trying to run a business, and you know, it's always around the holidays, it seems. But I'm not going to complain. I'm lucky to be here.
You have a clean bill of health.
I have a clean bill of health.
And during that event, where you had that sudden pain, your brother wasn't there. He was supposed to come to the event. Right. And you find out what?
Well, I went to meet the person who gave me the colonoscopy, the doctor, and I had heard my brother had been admitted, so I thought I'd meet the doctor and then I'd pop in and see my brother and see what was going on, you know, see how he was feeling. And that's when I was told that he had just been diagnosed with multiple myeloma, which is a bone cancer.
Just days?
Yeah, within about 10 days. Yeah, so it was kind of crazy. So, and he lived about another year. He passed in August of 2007, I think it was. So.
And you guys went through cancer and treatments together.
We had different treatments. He did a chemo pill, and you know, which he took at home, and I was at Portsmouth Regional Hospital where I did my chemo treatments. I used to go 4 days a week, about 10 hours a day, every other week. So we had different regimens, but we were actually going through pretty much chemo. You know, we were going through the chemo process at the same time.
How did that change your relationship?
Oh, it made us very much closer, and he pretty much, you know, knew that when he knew he wasn't going to beat it, we were able to share a lot, you know, a lot more than we ever were, and yeah, it was. It was another chapter, I guess you could say. I think, again, I was on autopilot. I was just going through it.
You had your parents died the year before.
Year and a half before.
Year and a half before.
Yep. I opened
You're
my shop.
diagnosed
Yeah.
with cancer.
Yeah.
Your brother's diagnosed, and then you lose your brother a year later.
Yeah. And I think what's really kind of funny, and maybe some people can relate to this, is I never thought about dying. I think I was too weak and just trying to focus on my shop, and I just never thought about it. And about 2 years out, I went to visit my oncologist because I'd go every 6 months. And I said to him, I started getting anxiety at night when I was sleeping. I don't know what I was thinking. And what he explained to me was that I had been through so much, even though I didn't think about it, that your body goes on autopilot. And it was 2 years later, my mind was catching up with my emotions. So when I would have like a little anxiety at night, or if I would just start to cry for no reason, he explained to me that to survive, I went in survivor mode and I went on autopilot, I guess. That's the only way I can explain it.
Yeah, you're quite the warrior, huh?
Yeah, I guess. I never think about it. I think you do what you have to do, and you just don't look back.
So this is the room that you take the women to. You're board certified
Mastectomy fitter. Right.
And so these are the bras. So the women come in here. Walk us through the process.
Well, when they come in, I have paperwork they need to fill out. And then we talk about, what they want for their everyday bra. I mean, obviously they're looking for symmetry and to feel whole again. But some ladies prefer lace, some ladies want a smooth cup. So I listen to what their everyday lives are like and what they're really looking to achieve as far as foundation-wise. And then I pull different sizes for them. And, we'll fit the bra first, and then we'll fit the prosthetic to the bra. Because it's really important that you want to fit the bra to the non-surgical side of the breast, and then find balance and symmetry with the proper breast form.
Why did you decide to get certified in as a mastectomy fitter?
Well, you just have higher credentials and you learn more. You learn more about the anatomy and the surgeries. I've been doing this for 20 years, and I would help women who would come in, give them symmetry, but I didn't know you could get certified, or never mind board certified. So, what I do, I want to be the best I'm at, and I really want to help women feel whole again. So I really wanted to know everything I needed to know. Right now I'm trying to, which is difficult because it's hard to find the right amount of time to do it, especially going into the holiday season, but I'm trying to get my business accredited to do medical billing, to alleviate out-of-pocket expenses for women. It breaks my heart. I turn away. I get phone calls sometimes once a day, a week, like 7 days a week, for women who want to come in and they want to, get fitted to their bra and their prosthetic. A lot of times they don't understand, they need to wait a good 4 to 6, 8 weeks out after they're healed. A lot of women are just so anxious to get that next phase of their life on, and they want to get fitted right away, which is not the case. So to answer your question again, is just I want to make sure I'm doing it properly, and like I said, be the best to help the ladies. The more knowledge I have, the better I'm at to help them.
You're featured in this book, Fearless Woman, Visions of a New World. Love this picture, Shelly.
Oh, thank
Love this picture. Tell me how this came about.
I was doing a bra fitting in Boston. There was a women's conference I was attending, and I was a vendor. And I happened to meet the woman who was the writer and the photographer of the book, Marianne Halpin. And this, I believe, is her fourth Fearless Woman book. And she just really captures women and what they do to help just mankind. And it's just this movement she really believes in. And this is the sword. And literally, when you hold that sword, you feel this energy go through your arms. It's an amazing, spiritual experience. And she had asked me to be in the book, and I really didn't think I didn't know why. I really never thought I had a story. I just do what I do, enjoy doing it, and but then I had a couple other women who belong to the conference that I've known for a few years and that I respect as business women, and they really felt like I should be, think about being in the book and being featured. And then I thought, all right, okay, I don't like my picture number one. It's just not my cup of tea. I wouldn't usually put myself out there, but I thought if it helps women, not just with colon cancer, but just to help inspire them for whatever they may be going through, then it was worth me doing it.
And this is your scar?
That's my scar. It actually, you can't really see it. In fact, I saw my surgeon the other day, and I was teasing him about it, that he made me look like I had abs, and I thanked him for it. Because what they did was they cut through the muscle, and for some reason, in the picture, I look like I have abs. And I thought maybe they photoshopped it, but they didn't. So
what is it like to have that scar appear there? How empowering
I never
was that?
You know what really empowered me more was my scar for my my port. I did 8 months of chemo 4 days a week, so I had to have a port. The chemo was very strong, and so they couldn't just go through your veins. So I had a port put in, and for me, the port was more empowering than the scar on my stomach. Isn't that funny? It's just a little scar, you can't even see it. I was always the type, if I had a scar or an imperfection, I wouldn't want anybody to see it. And then it was really strange because I thought I didn't care if the scar showed. It was my battle wound. I don't know if that makes sense. Yeah.
Beautiful.
So I think when you go through something, you learn little things don't bother you as much. You don't sweat the small stuff, and you have a new look on life.
Yeah.
Yeah.
How was getting chemotherapy? What kind of side effects did you have?
Well, I wasn't supposed to lose my hair. I believe it was called full fox. It was like a mixed cocktail they put you on, and it was a very aggressive because I had it for I had it 10 years. When they found it, they believe I had it 10 years because of the staging of the tumor, the size of the tumor.
Had it for 10 years.
Yeah, that's what their feelings are, because they can tell by the size of the tumor. And I'm lucky that I had colon, and it was a slow cancer. So, I don't know. Again, I kind of was a little naive about it. I don't think I thought much about it, because everyone I had known before I was diagnosed with cancer never made it. They always died no matter what kind of cancer it was. And I have a big family, or a large family history of it. So I don't know. I just checked out. I didn't think about anything. And I got violently ill. I lost about 10 pounds my first night of chemo. And I had to wear a fanny pack. And they just changed my whole routine. The next day I went in. The doctor spent 45 minutes with me. Unexpectedly, and they're busy. These oncology departments are very busy, but I had a wonderful oncologist, and he just rewrote the script and did it differently, and I never got sick again. And I think that's the good thing about chemo these days, is if you communicate with your physician or your oncologist, if you get sick, you need to communicate what's going on, because if you get sick, they can fix it, or they can amend it where you don't get sick again, or they can tweak it. And again, it's just communication. So
I love this line. My illness brought a sense of stark reality along with an inner strength that only a cancer survivor can experience. Very profound.
Thank you. I think it's tough because for me, I went 8 months, so I made a lot of relationships. And you would see different people come and go, and you'd see like a chair in the corner that John Doe would always sit in, and then John wasn't there. So that was the hardest part for me. I never really thought about what I was going through. I mean, I was very weak, but I didn't think about it. The hardest part was seeing the other people still going through it and fighting for their lives. So that for me.
How are you dealing with breast cancer survivors that come in here differently after you went through cancer?
Well, I've dealt with them. I've worked with these ladies for quite a while, and I always feel I was very sympathetic and empathetic. But I have a little more understanding if they're not feeling 100%. I've been their energy level, or sometimes they're very emotional. I don't know. I guess it's a little different after have gone through it. I just probably can relate to it a little bit more. Like I said, I've always had a nice or a sincere relationship with my clients when they come in. I try to listen. But maybe, if anything, I maybe have a little more patience.
What's your final message to women, men watching this who perhaps are battling cancer, any type?
I just think communicate with your physicians, your oncologist, and it depends on the cancer, but I think cancer is beatable, and I think you just have to just look straight ahead, don't look back, and stay positive, and keep family around, be around good friends and family, positive energy, and just have good people in your life, and try not to go there, the dark place.
Shelly, thank you so much.
Thank you.
That's our show. Thanks so much for watching. And if there's someone or an organization you think should be featured on Hometown Talents and Treasures, email me at esternvajda@gmail.com. Remember, it can be anyone. The important thing is that they selflessly donate their talent and time to help others. See you next time.